In the realm of global health, infectious diseases remain formidable adversaries, challenging both medical communities and societies at large. Among these, HIV or AIDS, tuberculosis, malaria, hepatitis B and C, and influenza stand out due to their widespread impact and complex nature. This video delves into each of these diseases, exploring their causes, transmission modes, global burden, and the ongoing efforts to combat them. By shedding light on these critical health issues, we aim to foster awareness and encourage proactive measures in the global fight against infectious diseases. Before we begin, please like and subscribe to our channel. HIV or AIDS. Human immunodeficiency virus is a virus that attacks the immune system, specifically the CD4 cells, T cells, which help the immune system ward off infections. Left untreated, HIV reduces the number of T cells in the body, making the person more susceptible to other infections or infection-related cancers. Over time, HIV can destroy so many of these cells that the body can't fight off infections and disease, leading to the most advanced stage of HIV infection, acquired immunodeficiency syndrome. AIDS is defined by the development of certain cancers, infections, or other severe clinical manifestations. The virus is transmitted through contact with certain bodily fluids of an infected person, most commonly during unprotected sex, or through sharing injection drug equipment. Significant progress has been made in this field, particularly with the advent of antiretroviral therapy, which has transformed HIV from a likely fatal diagnosis to a manageable chronic condition. While there is no cure for human immunodeficiency virus, effective treatment with ART can control the virus, allowing individuals with HIV to enjoy long and healthy lives and preventing transmission to others. Despite these advances, this continues to be a major global public health issue, having claimed more than 36 million lives so far. Increased awareness, prevention efforts, and accessible treatment are crucial in combating this epidemic, especially in regions with high prevalence rates and limited healthcare infrastructure. Tuberculosis. Tuberculosis, commonly known as TB, is a potentially serious infectious disease that mainly affects the lungs, but can also affect other parts of the body, such as the brain, kidneys, or spine. It's caused by the bacterium Mycobacterium tuberculosis and is spread through the air when people with lung TB cough, sneeze, or spit, propelling TB germs into the air. Despite being preventable and curable, TB remains one of the top 10 causes of death worldwide. The disease can be latent, meaning the bacteria remain in the body in an inactive state and cause no symptoms, or active, which means the bacteria are multiplying and can be transmitted to others. Only about 10% of those with latent TB will develop the active disease, which, if left untreated, can be fatal. Global efforts to combat TB have intensified, with strategies focusing on improving diagnostic testing, treatment, and prevention methods. The standard TB treatment is a 6-month course of 4 antimicrobial drugs that are provided with information, supervision, and support to the patient by a health worker or trained volunteer. Without such support, treatment adherence can be difficult, and the disease may spread. The rise of drug-resistant TB, where the bacteria become resistant to the antimicrobial drugs used to treat the disease, presents a significant public health challenge and underscores the importance of ongoing research, vaccine development, and global collaboration in the fight against TB. Malaria. Malaria is a life-threatening disease caused by parasites transmitted to humans through the bites of infected female Anopheles mosquitoes. When an infected mosquito bites a person, the parasites multiply in the host's liver before infecting and destroying red blood cells. In many parts of the world, the mosquitoes that carry the malaria parasite are most active between dusk and dawn. Malaria is most commonly found in tropical and subtropical climates where the parasites can live. The World Health Organization reports significant malaria cases and deaths in sub-Saharan Africa, but it's also prevalent in parts of Southeast Asia, Latin America, and the Middle East. Symptoms of malaria include fever, chills, flu-like illness, and in severe cases, it can lead to jaundice, seizures, severe anemia, and even death if not treated promptly. The fight against malaria involves several key strategies including prevention, primarily through the use of mosquito nets and insect repellents, prompt diagnosis, and treatment. Antimalarial medications are effective in treating and preventing malaria. But challenges such as drug resistance continue to complicate efforts to combat the disease. In recent years, there has been significant progress in malaria vaccine development, offering hope for a more effective prevention method in the future. The WHO and various global partnerships are working towards reducing the malaria burden, with the ultimate goal of eradicating the disease through improved healthcare infrastructure, community education, and the development of new technologies for disease control. Hepatitis B and C. These are significant health concerns globally, each caused by its own virus affecting the liver. Both conditions can lead to severe health complications, but they differ in transmission and management. Hepatitis B can be transmitted through exposure to infected bodily fluids, which can occur in various settings including healthcare, familial transmission, and other close personal contacts. This has led to the widespread adoption of the hepatitis B vaccine as a standard preventive measure, included in the immunization schedules of many countries to offer protection against the virus. Hepatitis C, characterized by its potential to silently progress to chronic liver conditions, is primarily transmitted through direct exposure to infected blood. The emphasis for hepatitis C prevention lies in the application of safe practices, particularly in healthcare settings and among populations at higher risk of exposure. The landscape of hepatitis C treatment has been transformed by the advent of direct-acting antiviral drugs, offering a cure for many individuals. In contrast, hepatitis B management may involve antiviral treatments to control the virus and prevent long-term liver damage, tailored to the individual's condition. Public health initiatives are crucial in educating about these diseases, advocating for safe medical practices, and ensuring broad access to preventive and therapeutic options to mitigate their impact. Influenza. Influenza, commonly known as the flu, is a contagious respiratory illness caused by influenza viruses. It can cause mild to severe illness, and at times can lead to hospitalization or even death. The flu virus spreads through tiny droplets made when people with flu cough, sneeze, or talk, infecting others nearby. It can also spread by touching a surface or object that has the flu virus on it, and then touching one's own mouth, nose, or possibly eyes. Influenza activity often begins to increase in October and can last as late as May, with peaks typically occurring between December and February. The flu's unpredictability, varying severity of seasons, and the ability of flu viruses to change rapidly make it a persistent public health challenge. Annual flu vaccination is the most effective method to prevent influenza and its complications. The vaccine is designed to protect against the flu viruses that research suggests will be most common during the upcoming season. Apart from vaccination, preventive actions like frequent hand washing and staying away from sick individuals can help reduce the spread of flu. Antiviral medications are another critical component of flu treatment. That's all we have for today's video. What are your thoughts on this? Let us know in the comment section below. And don't forget to subscribe to our channel for more future updates.